Hello and welcome to SOCF111, Foundations of Communication and Counselling. My name's Sylvia Newbaker and I'm going to take you through Session 1, Holistic Practice and Mindfulness. So the aims of today's session are to give you the opportunity to explore the use of reflection, knowledge, wisdom, intuition and mindfulness in therapeutic practice, and to identify, develop and maintain self-care strategies. So on successful completion, you'll have an understanding of the importance of building self-reflection and mindfulness into your practice, be able to define what is understood by mindfulness, knowledge, wisdom and intuition, and identify the reasons for ongoing mindfulness and self-care in practice. So before we get started today, I just thought that I'd go through some classroom etiquette. And this is something that I do in face-to-face classes as well. And I thought in a way it applies equally for online students as well. It's just having a bit of a sort of think about what the conditions are in terms of helping you to feel as comfortable as possible to share self-reflection and self-awareness with your fellow students. So what are the things that are important? What's going to help you to feel comfortable in this situation? So some of the things that students will say, just to give you an idea, is things like they need to feel safe, they need to feel respected, they need to feel that supported in whatever it is that they bring or say. They need to feel that they're not being judged. And they need to feel that there's actually a space for them to say what they want to say. So you might be able to think of some other things, some other conditions or some other qualities that you would want to see present in being able to be open and self-aware and self-reflective with your fellow students. And you might want to post some information about that on the loop. What I find interesting is that the sort of things that students come up with in terms of what they need is very often reflects the conditions that we would want our clients to feel as well. So it's a lovely exercise in a way, because what we need is also what our clients need. So now I'd like you to take a few minutes to think about what the qualities of an effective practitioner actually are. You can write these down after you've had a little think. And you might again want to sort of share some of your responses with the group on the loop. So thinking about what is it that makes an effective health practitioner? What are the qualities that really make them stand out? Perhaps you can think about a time when you've actually gone to see someone. What was it that sort of made that person a standout practitioner? So now we're going to talk a bit about mindfulness, and we're going to do a mindfulness exercise as well. Mindfulness, this is a quote, mindfulness involves learning to direct our attention to our experience as it unfolds, moment by moment, with open-minded curiosity and acceptance. Rather than worrying about what has happened or might happen, it trains us to respond skillfully to what is happening right now, be that good or bad. Here are some other thoughts about what mindfulness is, and there are many explanations and ideas around what mindfulness is. So here are some of them. Keeping one's consciousness alive to the present reality. Paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. A state of psychological freedom that occurs when attention remains quiet and limber without attachment to any particular point of view. Bringing one's complete attention to the present experience on a moment-to-moment basis. And here there are some links to some YouTube videos that you might like to watch. These are great. I particularly like the first one, which is a little sort of animation about mindfulness and what mindfulness isn't. So do have a look at that. There's also Dan Siegel, who's a neuroscientist who has done some wonderful work on the role of mindfulness in brain plasticity. So what is mindfulness about? It's being present to our experience, whatever that may be. It brings us closer to difficulties without becoming caught up in our reactions to these difficulties. It's a slow, gentle coming to know who we are, settling into our current experience in a relaxed, alert, open-hearted and compassionate way. So here are some things that mindfulness is not. It's not a relaxation exercise. This is often it's often confused with that. It's not a way to avoid difficulty, spacing out or escaping. And mindfulness is not about changing difficult thoughts or getting rid of difficult feelings. It's not religious. The point is not to change things, but to learn to peacefully coexist with what is through practice. It's about noticing our thoughts, feelings and sensations again and again, and about accepting these, all of them, with compassion. So compassion is really important. So what are the benefits of mindfulness? So this is what the research tells us. It helps manage depression and or anxiety. It helps us to be less angry or moody. It makes us happier and more emotionally stable. It reduces heart rate and improves circulation and breathing, and it can improve our immunity and help us to cope with pain. It can help clear our heads. It aids memory and concentration and happiness. It helps us to be more aware of ourselves, our body and the environment. It helps to slow down our thoughts and our nervous systems, and to sleep, relax and to cope with stress. So according to Dan Siegel, who I mentioned earlier, happiness is correlated with mindfulness. People who unintentionally let their minds wander a lot are unhappier. Research has shown that people who frequently engage in mind wandering, whether it's positive, negative or neutral, e.g. reflecting on last year's holiday or worrying about an upcoming exam or just daydreaming about cake, if done unintentionally and frequently, will be less happy than people who are present, moment to moment, and engage in intentional mind wandering. So intentional mind wandering is okay. So Dan says, when we achieve new skills of self-observation through mindful practice, it becomes possible to disengage automatically coupled pathways. With this new skill, the mind may create an important ability to free itself from the enslavement of triggers and prior learning. So it really is an amazing tool. It's a tool that we can use for ourselves as practitioners, and maybe something that you want to use with your clients as well in the future. So mindfulness is a tool for improving both practitioner and patient health. It promotes awareness in place of agitation, reflection in place of reflexivity, and humility and compassion in place of hubris. And now we're going to do a mindfulness exercise. So I'd like to invite you to find a comfortable position, and you might like to gently push your feet into the floor and get a sense of the ground beneath you. And just fix your eyes on a spot. And you might also like to sit upright with your back straight and let your shoulders drop. And then get a sense of gravity flowing down your spine, anchoring you to the ground, to the floor beneath your feet. And just take a moment to notice what you can see. And notice what you can hear. And notice how you are sitting. Notice what you're doing with your hands. And the sensations in your nose and your mouth. You might notice the breath as it passes into your nostrils and down into your lungs. And then notice what you're feeling in the rest of your body. Notice what you're thinking right now. And then take a moment to recognize that there's a part of you in there that is able to notice or be aware of everything that you do. Everything that you see, hear, touch, taste, smell, think and feel. And for the sake of simplicity, let's call this part of you awareness. And I invite you now to close your eyes or keep them fixed on a spot, whichever you prefer, and to bring your awareness to your breathing. And for the next few breaths, I'd like you to completely empty your lungs, to push all the air out of them until there is no more left, and then allow them to fill by themselves. And as you do that, I'd like you to observe your breathing as if you're a curious scientist who has never encountered breathing before. Just noticing. Notice how once the lungs are empty, they refill all by themselves. You can take a deep breath in if you want to, but see if you can notice how there's really no need. It just happens by itself. Notice your breath flowing in and out. Notice your chest moving in and moving out. Notice your abdomen rising and falling. And now I'd like you to reflect on why you're here today. There is something that matters to you, something that is important deep in your heart that motivated you. What is it? Is it about improving your life, personal growth, learning new skills, building better relationships? Is it about using your time on this planet more effectively to help others or to help yourself, or both? Is it about work? Is it about your health and well-being? Is it about learning how to look after yourself? Just do a search inside your heart. And now take a moment to reflect on how you got here today. You didn't just magically materialise out of thin air. You had to take action. You had to organise. You had to reschedule. You had to make time. And recognise that right now you are also taking action. You are sitting here in a chair doing this exercise, not knowing exactly what it involves. You probably have all sorts of thoughts whizzing through your head and all sorts of feelings passing through your body. And yet here you are, sitting in a chair right here, right now, doing this exercise. And what is it that matters enough to you to bring you here today to take this action right here, right now, when there are so many other things that you could be doing instead? And now, once again, I'd like you to bring your awareness to your breathing and observe it as if you're a curious scientist who has never encountered breathing before. Notice your breath flowing in and out. Notice your chest moving in and moving out. Notice your abdomen rising and falling. And now I'd like to invite you to undertake a challenge. For the next few minutes, your challenge is to keep your attention on your breath, observing it as it flows in and out. This will be hard because your mind will try to distract you. It will tell you all sorts of stories to try and grab your attention and pull you away from what you are doing. Your challenge is to see if you can let those thoughts come and go like passing cars and keep your attention on the breath. Notice your breath flowing in and out. Notice your abdomen rising and falling. From time to time, your mind will succeed in distracting you. It will manage to get you interested in one of its stories and you will lose track of your breathing. This is normal. It happens to everyone and it will happen repeatedly. The moment you realise this has happened, take a split second to acknowledge it and note what distracted you, then gently refocus on your breathing. Just notice the breath. Let your thoughts come and go like passing cars. Again and again your mind will succeed in distracting you. This is normal. This is what minds do. So as soon as you realise it, note the distraction, then gently refocus on your breath. As this exercise continues, the feelings and sensations in your body will change. There may be pleasant feelings and sensations showing up, like relaxation, calm, peacefulness. And there may be unpleasant ones, like boredom, frustration, anxiety, or backache. See if you can allow these feelings to be exactly as they are in this moment. Don't try to control your feelings, just let them be, regardless of whether they are pleasant or unpleasant, and keep your attention on your breathing. This is not a relaxation technique. You're not trying to relax. The aim is to allow yourself to feel whatever you are feeling without a struggle. The aim is to allow yourself to feel whatever you are feeling. So if there is an unpleasant feeling present, then silently name it and say it to yourself. Here's a feeling of boredom, or here's a feeling of peacefulness. Acknowledge it's there and keep your attention on your breathing. again and again and again, bringing your awareness back to your breath. And now, expanding your awareness, noticing your breathing and your body in the chair, your arms, your legs, your head, your neck, your chest and tummy. And then expand your awareness even further, noticing your breathing and your body in the chair and all the sounds around you, and opening your eyes and looking around the room and noticing what you can see. And then expanding your awareness even further, notice also what you can feel and also what you can taste or sense in your nose and your mouth. And having a stretch now and noticing yourself stretching and noticing what you are thinking right now, noticing whatever your mind is saying to you about this experience. And taking a moment to realise that there is a part of you that notices everything you do, everything you see, hear, touch, taste and smell, and think and feel. And just check in for a moment, this part of you that can notice your thoughts, notice your feelings, notice your body. Is it good or bad? Or is it just there? So thank you very much. This brings us to the end of this exercise. Have a stretch and I'll be back in the next section. Thank you for listening.